welcome everyone. We'll discuss today regarding Pseudomyxoma Peritonei. So what is Pseudomyxoma Peritonei? It is a clinical condition that is caused by cancerous cells. So large number of cancerous cells get accumulated and that produces abundant mucin, and the mucin is of gelatinous type. It's a kind of a thick gelatinous material gets collected in abdominal cavity and that produces gelatinous ascites. The disease is most commonly, this is very commonly being asked, the most common cause is appendiceal mucinous cancer. That is the most common cause. It may be also caused by appendiceal mucinous adenoma, but most common cause is mucinous adenocarcinoma. Mets of the tumor of metastatic tumors from the ovary or the primary mucinous tumor of the ovary have also been implicated. The most common cause, however, is the appendiceal carcinoma, followed by ovarian tumor. That could be either primary ovarian tumor or metastatic tumor from GI tract or appendix that has metastasized to ovary, and then later on the ovarian tumor has ruptured and spilled the mucinous content into the peritoneal cavity. The tumors cause fibrosis of the tissues, and there is it causes impeding of the digestion and the organ function because it compresses the abdominal organs, and the tumors and the mucin that can fill the entire abdominal cavity if it is not removed or if it is left untreated. So here in this image you can see the mucinous material. The mucinous material is seen over here, the mucinous ascites, the gelatinous material, and there is a homogeneous eosinophilic fibrotic material that is surrounding that, and there is also a kind of a strand of columnar epithelial cells, kind of a mucinous columnar epithelial cells without much of cytological atypia is being seen over here. So this is the typical histological feature of Pseudomyxoma peritonei. Pseudomyxoma peritonei could be broadly demarcated into low-grade type and high-grade type. Low-grade type is often regarded as disseminated peritoneal adenomucinosis, DPAM. So here there is abundant mucin, and there is some either scant epithelium is there, or even if there is epithelium that is without any significant atypia, with minimal degree of cytological atypia it is there. So it is DPAM. Now next one is the more commoner one is the carcinoma, which is called as peritoneal mucinous carcinomatosis, PMCA. Here there is a abundant mucinous epithelium with strand of epithelium, and there is epithelium is showing significant atypia, and this is associated with appendiceal carcinoma, and often we get signet ring cells associated with this peritoneal mucinous carcinomatosis. So the treatment that is being conferred to these Pseudomyxoma peritonei is cytoreductive surgery with localized intraperitoneal chemotherapy is being given for low-grade disease, and for high-grade disease, systemic chemotherapy with or without surgical intervention is done for high-grade disease. So let's have a quick recap. So Pseudomyxoma peritonei is a mucinous ascites with fibrotic reaction, and there is close association with appendiceal mucinous neoplasm in most of the cases. Sometimes ovarian mucinous neoplasm is also associated. So it is low grade with no epithelium or bland epithelium is there. High grade with signet ring cells and atypical epithelium is being found. So this is how to distinguish between the low and high grade Pseudomyxomatous peritonei, and the treatment includes surgery, and there is localized chemotherapy for the low-grade disease, and for the high-grade disease, for the cancers, there is systemic chemotherapy is being indicated. So thank you for your attention and hearing the video, and don't forget to give your valuable feedback, share, like and subscribe to the channel, and stay tuned for more upcoming videos. Thank you.